At this time, ladies and gentlemen, please welcome Dr. Faith Gibson Hubbard, Director of the Mayor's Office of Community Affairs and Executive Director of Thrive by Five.
Good afternoon and welcome, everyone. Look at all of us in this room today, here together after so many months apart. And while we are masked, and I do ask that you keep your mask on, I am so excited to see each and every one of you here in this room today, both in the room, but also so many people who are also watching with us through the app or through Facebook Live or on television and streaming this right into their home. My name is Dr. Faith Gibson Hubbard, and it is my distinct honor to serve as both the Executive Director of Mayor Bowser's Thrive by 5 DC and the Director of the Mayor's Office of Community Affairs. In the District of Columbia, while we think about maternal and infant health every single day, this time of year is particularly special to me. I love the summit, and I love this annual convening that we have where we can build collective impact to take action on issues and create opportunities in the spaces that we know are impacting our city and families and babies. We can work on this together, and every day, we, with the birth of a new baby, have brand new opportunities to experience joy and to feel the reemergence of hope. That hope and what we know is possible fuels us in our work. It pushes us to find creative pathways to equitable outcomes for all district families, birthing persons, and our babies. And over the last 4 years, we have harnessed this hope in community together, right here in this room, with the conversations that we have, with the relationships and work that we do together, and also for the great things and change that we know come from this time here today. It's just a beautiful experience that I know so many of us have been able to be a part of. This year, we are convening to talk about our village and how our village can keep pushing us forward and we can witness progress together. I cannot wait to hear about the discussions that will come forth from today and the great work that we will continue to do together as community. I want to first take a moment to thank our partners who have made this year's summit possible. Sibley Memorial Hospital, Care First, Johnson & Johnson, United Healthcare, March of Dimes, MedStar Health, White Ribbon Alliance, the George Washington University Hospital, Children's National, and Aetna. I also want to give a special thanks to all of our agency partners and offices who have made today possible as well. DC Health, the DC Department of Healthcare Finance, the Department of Employment Services, the Mayor's Office of Community Affairs, Serve DC, also known as the Mayor's Office on Volunteerism and Partnerships, and also a huge shout out to my Thrive by 5 colleague, Tiffany Wilson, and her hard work. But I want to close in very deep gratitude and also to give honor where honor is due to our fearless and phenomenal leader, Mayor Muriel Bowser. Mayor, I thank you for your vision that has brought us here today. It is your vision that has shed light on a conversation that is in the shadows in so many other places. A conversation that allows people to be seen and for their stories to be heard in a way that sparks action and results. Thank you for your vision and courage in bringing us here. And thank you for giving us the opportunity to come together and to create a model for other cities and states to follow. Your leadership is what makes our home stand above so many others, and definitely ready to be the 51st state. I thank you for this amazing opportunity to lead, and I thank you for your support. And without further ado, I would like to introduce to you our mayor, Mayor Muriel Bowser.
Good afternoon, everyone. I am delighted to see you all here in person and watching by the thousands on various channels for this very important discussion. So welcome to the 4th Annual National Maternal Infant and Health Summit. And please give a round of applause to everyone in DC government, Faith Hubbard, Thrive by 5, and all of our agencies and partners in bringing us together. This is now our second summit where we are having a virtual experience, and this year an in-person experience as well. And even before going virtual was a part of our new normal, we have always had a virtual option for this summit because we know when we talk about issues faced by women and families and healthcare nationwide, it is important to be available and being available in many formats. I want to just reiterate a few of the messages that you're going to hear over the course of today and tomorrow. You're going to hear about the critical connection between supporting healthy families and raising healthy children. I've spent, for example, the last 3 weeks visiting DC public schools because our schools are back open. And we're very excited to welcome children to in-person learning, full-time, 5 days a week for all children. And at every school I've seen happy students and happy families, kids excited to be reunited with their teachers and friends. And at every school, my charge and the charge of our community is clear. How do we give children, whether they're 3 years old or 13 years old or 17 years old, every opportunity to thrive in the greatest city in the world? And what everyone today here knows is that the work begins long before the first day of school, and the work continues after our young people have grown up and graduated. If it was just about having the best hospitals in the nation, and we do, our work would be done. If it was just about increasing high-quality care, our work would also be done. And if it was just about having the political will, our work would be done there too. But it's about all of those things and more. Dr. Nesbitt likes to remind us it is about addressing the underlying issues that determine our health too. It's about taking on the systems that put Black and brown women at greater risk before, during, and after pregnancy. And now we face a new challenge. We know that the systems and structures that perpetuate inequalities and disparities in health outcomes have been exacerbated by the pandemic, and that women, particularly women of color, have been hit hardest, both personally and professionally. We know that, for example, that there are 1.8 million fewer women in America in the workforce than before COVID. One study found that 80% of moms with kids under the age of 12 were responsible for the majority of distance learning in their homes. Anybody know about that? That there's evidence to show that women are being disproportionately impacted by Zoom fatigue. And while we may not yet understand the full scope of these effects on women and their families, we can anticipate that the ripple effects will be far-reaching and long-lasting. At each of these summits, we have sounded the alarm on the fact that Black women are 4 times more likely than white women to die from a pregnancy-related cause. But if we're serious about closing the gap, that can't be the only alarm we sound. In our experience with COVID, we've learned, and it has taught us a lot of lessons. But one thing that we have learned is that the decisions we make around health care really affect the experience of Black women in our city. We know that, for example, that child care is health care. And across our nation, Black moms are less likely to work from home, less likely to be able to take time off from work, and more likely to be solely responsible for caring for their children. In fact, when we came together at this summit just 2 years ago, we focused on centering the narratives of moms and the connection between maternal and infant health and early learning. Since then, In DC, we have piloted and then made permanent a new child care tax credit to save families up to $1,000 per child every single year. It's a good thing. And in line with our city's longstanding commitment to free preschool, or free pre-K3 is what I like to say, we also opened 2 new standalone early learning centers in DC public schools. Last year at Stevens School and this year at the Military Road School. And also this year, in the budget that goes into effect in just 2 weeks, we invested $184 million to expand access to affordable quality childcare and strengthen our early learning system in the District of Columbia. And just like childcare is healthcare, so too is affordable housing, especially when Black women are the most likely to face eviction. And we know that a living wage is also healthcare, especially when Black and brown women are overrepresented in lower paying jobs and the most likely to benefit from the $15 minimum wage that we have here in Washington, D.C. Last year, we also touched on these issues when we strategized about using lessons learned in the pandemic to better inform our approaches to healthcare and make our systems more responsive to the needs of families. Since then, we've gotten more than $140 million in federal relief into the community to pay rent and utilities for our residents. It's a good time to remind everyone that Stay DC can help residents impacted by COVID to stay in your homes. So please contact us at stay.dc.gov. We've also quadrupled our investment in the Housing Production Trust Fund from $100 million to $400 million. We've expanded our use of telehealth to support critical programs and keep women connected to their doctors. And in the coming budget, we've allocated $8.5 million to support 5 centers of excellence at Howard University, including a center on women's health. And if you really want to see a big example of what we've been working on a number of years, bringing all parts of the government together to focus on making sure we had quality care in Ward 8 at St. Elizabeth's Hospital, on the St. Elizabeth campus, I should say. In 2015, we announced our plans to bring the entertainment and sports arena to the St. Elizabeth's East Campus. We said then that our commitment was bigger than basketball, and we certainly meant it. We've been, of course, putting together a plan to address disparities, economic, housing, jobs, and education. Today, the new arena is built. In fact, we've already won a championship. The WNBA championship banner flies there. But the campus is also welcoming new residents because new affordable townhomes are being sold there. We broke ground on a new Whitman Walker healthcare facility. A new shelter for men experiencing homelessness is being built and being built by the residents of that shelter. The campus is no longer just a vision of jobs and prosperity. It is a source of jobs and prosperity. And at the center of it all will be a brand new state-of-the-art hospital, and we're very proud of that achievement. Today, I come to you with more good news. Today, we are proud to announce that we have an agreement in place with the Children's National Hospital to operate and staff the Pediatric Emergency Department and the Neonatal Intensive Care Unit at our new hospital. So let's hear it for Children's. We know what that means for babies born all across our city and in Ward 8. and we know what Children's National means to our entire city. I want to thank everyone who came to the table to get this partnership in place, especially Kimberly Russo, the Vice President of Universal Health Services, who will operate the new hospital at St. Elizabeth's, and Dr. Kurt Newman, the President and CEO of Children's National. Please stand and be recognized. The new hospital at St. Elizabeth's is evidence of what is possible when we recognize a challenge and work together. So we're going to stick together on these tough issues. We will stick together to make sure that DC residents are getting back to the doctor for their annual exams that they have skipped during the pandemic. We will stick together to ensure that our families are getting vaccinated and that we are clearing up misinformation about vaccines, especially for women who are pregnant and want to get pregnant. Let's be clear, the evidence is clear. The vaccine is not only safe for pregnant women or breastfeeding women or those who want to become pregnant, but it is recommended by public health officials. And we are going to stick together in giving all of our families in Washington, D.C. This is the whole reason why we're here, and the whole focus of our government is to look at our vast resources and talents across the city and ensure that every single one of those resources, human resources, financial resources, is being strategically invested to give every single person a fair shot in Washington, D.C. This discussion is hugely important in that regard, and I invite you to stay tuned to the important panel discussions, the breakout discussions, the affinity groups that form around important issues related to healthy babies and improving our experience in Washington, D.C. Thank you, everybody.
Ladies and gentlemen, please welcome Dr. LaQuandra Nesbitt, Director of DC Health.
Hi, I am Dr. LaQuandra Nesbitt, the Director of the District of Columbia Department of Health, and I am excited to welcome you to Mayor Bowser's 4th Annual National Maternal and Infant Health Summit. Throughout the COVID-19 pandemic, DC Health remains committed to our perinatal health and wellness goals. Community partners offering direct service programs such as WIC and maternal, infant, and early childhood home visiting programs were able to pivot from an in-person only model to a virtual model to meet the needs of families. With the use of technology and telehealth, continuity of these critical services was maintained. Consistent with the recommendations of the Mayor's Commission on Healthcare Transformation, we've invested in the creation of an initiative that connects community-based outpatient prenatal care providers for district residents living in Wards 7 and 8 to the city's hospital-based labor and delivery programs for more seamless and integrated care. We continue our focus on preterm birth reduction and on improving the health of women before they become pregnant to address the leading causes of infant death in the district. And we're doing this with strategic partners such as MedStar Washington Hospital Center, Unity Healthcare, Community of Hope, and Howard University. Notably, we have worked collaboratively with Howard University to launch the development of a Center of Excellence for Women's Health that will leverage and foster the university's cross-disciplinary expertise. During the summit, you'll have the opportunity to identify and share best practices for pregnant women, babies, and families in DC, given our local context and unique assets to promote gender-inclusive and patient-centered sexual and reproductive health care, and to think deeply about our shared district values and how to ensure that every baby born here from every neighborhood celebrates their first birthday and beyond and can thrive into a healthy adulthood. Over the next 2 days, you'll gain insight on how we in the district continue to ensure the health of women, babies, and families through panel discussions and community-led breakout sessions that were developed to connect district residents with resources, both locally and nationally, as well as familiar support, so everyone achieves their optimal level of health. A stimulating and inspiring agenda has been planned. So I want to welcome you once more, and I hope you enjoy this year's National Maternal and Infant Health Summit. Thank you.
And now we will hear from our DC Hope presenter partner, Sibley Memorial Hospital and Johns Hopkins Medicine.
Hello, I'm Carolyn Carpenter, President of the National Capital Region of Johns Hopkins Health System, which many of you know includes Sibley Memorial Hospital and Suburban Hospital. I am deeply honored to bring greetings to you today in recognition of Mayor Bowser's 4th Annual Maternal and Infant Health Summit. Childbirth is one of the most memorable times in the life of a family, and all expecting mothers and fathers deserve the right to deliver a healthy baby. No child should be at higher risk of birth complications. No mother should be at higher risk during childbirth simply because of the zip code where she lives or her skin color. Sadly, across the District of Columbia, this is not the case. Black mothers are more likely to die during childbirth across the district, and Black and Hispanic babies have a higher chance of preterm complications than non-Hispanic white babies. Mayor Bowser's Maternal Health Initiative is changing this harsh reality by bringing together stakeholders from across the district in very unique and innovative ways. The Mayor's initiative brings together the depth and breadth of the DC community's most critical resources for maternal health, from preconception to post-delivery. The combined effort is helping to create health equity and improve the quality of maternal care for women all across the city. Johns Hopkins Medicine is not only honored to be part of the conversation, we are committed to being part of the solution. We are partnering with communities in Ward 7 and 8 to invest in citizen-led, human-centered maternal health care innovation. We are doing the work that we need to do to ensure that Sibley Memorial Hospital is more accessible to all women in the district who wish to have their babies with us. And we are committed to doing our part to help improve the maternal health experiences and outcomes for all women in the District of Columbia. Thank you for your time today, and I look forward to the insights and solutions that emerge as part of this very critical community conversation.